Okay, so now we're going to cover the 4 muscles that are in the pelvic area. But first, before we do that, let's get our 3 reference muscles drawn in here so you remember them. First, starting up at the iliac crust and going all the way down to the tubercle, on the anterior lateral condyle. That would be the iliotibial tract. And then on the other side of the leg, starting down in the pubic ramus, in the anterior pubis, going all the way down to the medial tibial shaft, right down there. That's going to be the gracilis. And then finally, from the anterior superior iliac spine, down and across the femur to come down and join up with the gracilis and the medial tibial shaft. That is the Sartorius. So what we're going to focus on right now are the muscles groups that go right between the Sartorius and the Gracilis right here. All of this. There's only 4 muscles right here that you need to know. But so you can use these as a reference point. It's going to be on the medial side of the Sartorius and on the lateral side of the Gracilis. So first, what we want to look at is the Iliacus. And that's iliac, like the Ilium Iliacus. So the ilium is this big elephant ears right here. This whole thing is the ilium. And inside the ilium, there's an indention. This whole thing is like a depression, an indention in here. It's called a fossa, which means indention. So this is the iliac fossa. And this is just a feature on the bone. And then we have down here the lesser trochanter of the femur. You remember the lesser trochanter of the femur. So this muscle is going to go down from the iliac fossa down to the lesser trochanter. So we'll color that in like that. And remember, the Sartorius is right here. So as you can see, it's the first thing next to the Sartorius on the medial side of the Sartorius. And this muscle is called the Iliacus, like I said. So first we have the Iliacus muscle attaching up at the vertebrae, and this actually attaches from T12 to L5. So your entire lower back, it attaches to the side of your entire lower back, your lumbar spine. And then, of course, once again, the lesser trochanter is right down here. And so this muscle comes down from your spine, and it's right next to the iliacus. And this is called your psoas with a silent P. Now, these 2 muscles merge together once they pass the inguinal canal, which is right here. Here's the inguinal canal. Once they pass the inguinal canal, they merge together and they both attach to the lesser trochanter. So once the iliacus muscle and the psoas muscle passes through the inguinal canal, they're merged together and they're referred to as the iliopsoas. But you can still see them, like on the models, you can still see where they're divided in half, and they're just attached one right next to each other. You can still see them separately, but together in this area, a lot of times they're referred to as the iliopsoas. Now, next to the psoas muscle, attaching down here next to the pubic tubercle on the pubic ramus, right here, and down to on the back of the femur. Remember, there's that linea aspera on the back of the femur. Well, this attaches just above the linea aspera on the back of the femur, and I'll show you the back in a minute. And this is called the Pectineus. So we have the Iliacus, the psoas, and then next to that, fanning out, going in a different direction, if you notice, because the Iliacus and the psoas are coming down. They're not straight up and down, but they're only diagonal a little tiny bit. And this Pectineus is completely diagonal because it's coming from the pubic ramus over to the Pectineus line right above the linea aspera on the posterior side of the femur, because it wraps around the back of the femur. Now one more, so there's only 4 of them. One more attaches right next to the Pectineus muscle attaching. It attaches to the pubis right here. And this goes down, this follows the same path as the Pectineus. It wraps around the back of the femur and it attaches to the linea aspera, which is right beneath where the Pectineus attaches. And so the Pectineus and this muscle are both next to each other, and they're both at a very diagonal direction. And this one is called the Adductor Longus. Alright, so let's look at that one more time. So we have up here at the iliac fossa, down to the lesser trochanter is the iliacus. Up here at the lumbar spine, and also down to the lesser trochanter, same place, is the psoas muscle. Right next to it, from the pubis, the anterior pubis, down to the pectineal line above the linea aspera on the back of the femur. That is the Pectineus. And then right next to it, maybe a little bit lower than it, but right next to it pretty much, and down to the linea aspera right below the Pectineus attachment, is the Adductor Longus. And just to remind you where this is all at in the context of things, the Sartorius comes down here and crosses over the femur right here and inserts in the medial tibial shaft. So as you can see, these 4 muscles, this is a little bit bigger, these 4 muscles are the 4 muscles to the medial side of the Sartorius, up at the top of the Sartorius. And that's it before you get to the Gracilis. Which comes down and attaches with the Sartorius. So up above where the Sartorius crosses over the femur, there's these 4 muscles on the medial side on the pelvis. The Iliacus, the Psoas, the Pectineus, and the Adductor Longus. So now here's the back. Here's the posterior view. And remember, this is the tuberosity, and here is the linea aspera. On the back of the femur. And right above the linea aspera is a little line called the Pectineus line. I don't think you need to know that. I think you just need to know it's on the back of the femur. So the Pectineus starts at the pubic ramus in the front. So it's on the other side in the front. And it comes down, wraps around the back of the femur, and attaches on the back of the femur. So this is coming from the front, and see how it wraps around and attaches to the back. And then the Adductor Longus is also attached to the front of the pubis, and it comes down right next to the Pectineus, and it attaches at the linea aspera in the back. It wraps around the back of the femur, attaches at the linea aspera right there. So that's the back view of that Pectineus and the linea aspera. So here's what it looks like on a diagram. This over here on the right, or on your right, on the patient's left, this is going to be the Pectineus. Do you see how the Pectineus attaches right here at the pubic ramus? And then it comes down and it wraps around the back of the femur, and it attaches back there behind the femur. And this Pectineus muscle, they have this on the other side of the body because it's covering up some other muscles over here that we'll learn when we get to the back side of the leg and the pelvis, because it's actually not, you can't see it from the front. The Pectineus actually starts up here at the pubic ramus by the inguinal ligament, and it comes down and covers up those muscles, because those muscles are going to be seen from the back, not the front. So don't worry about those right now just yet. And then right next to the Pectineus is going to be the Adductor Longus. See how this comes down? This starts right next to the Pectineus in the pubis, on the pubic bone. And it comes down, and it's right next to it. So they're kind of touching. And it also wraps around the femur and goes to the back of the femur to the linea aspera. Now this next muscle, you're going to see this from the back, so we're not going to worry about this right now. And here's the gracilis. Here is the muscle that goes all the way down your inner thigh and attaches down at the medial tibial shaft. So this is one of your reference point muscles. So this is the gracilis. And the Sartorius would be up here, would start up here and come down and then cross over the femur like this. And then it would come down and attach in the same place as the gracilis. So when you're looking at the models, what you're looking at is this Sartorius and this gracilis, framing these two muscles, the pectineus and the adductor longus, right here. And then also, of course, you have here's the iliac fossa, and this whole muscle, this entire muscle up here, is the iliacus. And then see, it passes through the inguinal ligament and it comes down right here. And it attaches to the lesser trochanter right there. So that's the iliacus. And then from the spine, from T12 to L5, so all the lumbar spine, so all the lumbar vertebrae, this one comes down, and this is called the psoas. There's actually a psoas major and a psoas minor, but I think all you need to know is the psoas. You have to check with your teacher on that to make sure. But see, it comes down, it passes through the inguinal ligament, and it comes down right next to the iliacus right here, and it attaches to the lesser trochanter as well. And when these two are together, when the iliacus and the psoas are together down here, inferior to the inguinal ligament, this is sometimes referred to as the iliopsoas. But it's just the iliac muscle and the psoas muscle combining together so they can both attach at the lesser trochanter right here. So iliac, psoas, pectineus, adductor longus.